from potable water and educational struggles of the Volta region village of Mangotideke. The chief there is also their midwife. There's no health center in the village and deliveries are made on the floor, bathrooms and bedrooms. But there is good news. 5.5 years after JoyNews told the story, a lecturer at the Ho Technical University has mobilized his friends to build a delivery center for the community. Gifty Andwapia reports.
I
am a chief and deliver babies. I can do what the nurses and the midwives do.
Meet Togbi Moses. He is chief of the village and their only midwife.
One of the women he has delivered of 4 children is Maufomo Lugudo.
This is Maufomo in December 2013, then in labor on a bathroom floor as Togbi Moses, her chief, prepared her for delivery with some concoctions.
I use traditional medicine to help the women to deliver the babies.
She labors through midday and delivers at midnight at the bare hands of the village's favorite midwife.
He uses a random piece of razor to cut off the umbilical cord. Life without potable water, standard formal education, and healthcare, as well as a decent place of convenience, has just started for this baby boy, just like all the others who live in this village.
Maufamo's baby is now a proud 5.5-year-old. He even has younger siblings. Togbi Moses is not only the traditional and spiritual leader of the over 500 people who I'm told live here. He has been their midwife since the 1980s, with over 100 babies delivered through him. He told me he has had some training from nurses in a nearby community.
None of those children has died.
His major challenge was getting gloves for his hand during delivery and disinfectants to avoid infections.
I do not have gloves and I don't even have disinfectants, but I really need them for the deliveries.
On my return 5.5 years on, a lot more children have been born, and I spot at least 3 more pregnancies.
Nothing has changed since you came here. We still don't have gloves and disinfectants.
After I told that story in 2012,
a lecturer at the Ho Technical University has been mobilizing a group which intends to donate a delivery center for the women here.
The community has already designated a place for the birthing suite to be built, but that promise is taking a while to be delivered. So I set up a meeting between the lecturer, Dr. Divine Novieto, and the DCE.
At that short meeting between the DCE and the people of Mangotideke, the people were assured their delivery center will be completed as soon as possible.
It is perhaps a coincidence, but on the day of the meeting, the entire village is thrown into a state of mourning. Someone has just died. They told me she was being cared for by a spiritualist in defiance of an advice to go to the hospital. My mind races. Could the story be different if there was at least a nurse or CHIPS compound in this village? I may never get an answer. But that is the fate of Mangotideke. Young girls ushered into early motherhood, waiting in the queue for the only midwife who doubles as their chief and who has neither a safe place for the deliveries nor basics like gloves and disinfectants to make his work safer for all. Meanwhile, Maupomo and the other women are waiting in anticipation of the birthing suit promised by a philanthropist, sometimes even oblivious of the responsibility government should have towards them. The project has taken off.
So I'll take you around the building for you to see the way that is going on so far. This is the back side of the building, and from the recovery room we move to the veranda. You can see them standing in the middle. That is the veranda with the mason working. I'll try to get a little bit closer to him. Those are the workers there.
but a lot more help is required.
I am Mapomo Lugudo. I delivered my children in the bathroom and in the bedroom. There is no befitting delivery center here. We are appealing to authorities to come to our aid.
Gifty Ando Apia, JoyNews, Mangotideke.
Divine Novieto is the lecturer at the Whole Technical University who's mobilizing his friends to build the delivery center you just saw for the people of Mangotideke. He joins me on the line. Good morning, sir. Thanks for your time.
Hello, good morning. How are you?
I'm doing well. Hope you are great too. I must start by saying thank you so much for agreeing to help the people. But how did the story come to your attention?
Yeah, thank you for the opportunity. And also, I would like to say good morning to your viewers. Well, this story came to my attention one time when I was watching JoyNews, and if the Apiando happened to have covered this particular story extensively, and I got interested, so I contacted the JoyNews desk that I wanted to speak to Gifty. After preliminary cross-examination, I was given access to her number, and then I called her and I said I was interested in helping the project. I wanted to do design for the project. Should somebody be interested in building it? So I was ready to offer free service consultancy in regards to the design of the place. As it turns out, we did a design in consultation with some health professionals and also for the local people, and also have taken up the mandate of organizing my associates so that we can together put together the health post, Birthing Street, we call it, for the Mangotideke people. So briefly, that was how the whole thing started, and that is where we are right now with the construction of the Birthing Street, which is at a window level. We are hoping that by close of this week, we'll get it to the roofing level, and we're looking at within 2 months' time, we should be done by that project.
This is work really, going really fast, and I must say it is really commendable. But one may want to ask, apart from seeing the story and getting interested, is there a personal link? Is there anything from your personal life that inspires or compels you to really do this for the people of Mangotideke?
Well, I'm not directly related to anybody at Mangotideke, but I think that when I saw the story, I was touched. In natural fact, when I was attending school at the Whole Technical University those days at Whole Polytechnic, we did a lot of social outreach programs and community outreach programs. So when I saw this, it was an opportunity to put my skills at the disposal. So I wanted to offer a free service without charging for it, because I felt that if we have to help the people, we need to donate some of our resources to them. So it was an opportunity to help the community that is in need. So when I saw the story, I was just touched, and I just took it upon myself that this is an opportunity to now contribute something to the underprivileged. So that was what sparked off the motivation in me. And Gifty has been tremendous. She sometimes puts the pressure. It checks up to see what we're doing. But the recent successes that we saw with regards to people contributing to this particular project has been tremendous, and we have to congratulate Gifty for her efforts to push the project. And I'm pretty sure that within the timeline that we have given, we'll be able to do a very good job, and then you'll come and cover it and see what we have.
We definitely will be there. But before I let you go, Mr. Novieto, any challenges with this project?
Yeah, we faced initial challenges. In actual fact, this particular project, we decided that we're going to do it in conjunction with the district assembly. So when we put together the design, we approached them, and then we also discussed some of the things that they also needed to help us with, especially with some materials to support the ones that the associates that I'm working with, friends like Padis in Accra and some other colleagues like Mr. Kennedy, the finance officer. They were also helpful with regards to that. So we contacted them. They promised us some. It took some time for them to deliver some of the materials. And then after they delivered, we started the project. They are still yet to donate some. I had a meeting with them this particular week to say that we need a timeline to finish up this particular project.
All right.
We have our resources there, so we want them also to put their resources on the desk, and they have agreed. So we are moving at the speed of sound, and we'll finish pretty soon. In 2 months' time, we should be done by that.
Thank you so much, Dr. Novieto. We definitely will stay in touch. Thank you for the good work you and your friends are doing. Now, let me come to the source of all of this, Gifty Andro-Appiah. I must say that 5 years is a long time coming, but it's still worth it. Better late than never, isn't it?
It is. I mean, I don't even know where to start, but it is a long time. It's actually beyond 5 years now. We're getting to 6 years already, Bernice. I'm happy to hear this morning, and we don't have the DCE at the moment, but we've spoken to him. He spoke on the AM show earlier. He's spoken on the Super Morning show as well. He said that they're going to send some water to the people on Monday. Okay. On Monday, so that's a start. But coming back to the delivery issue, I think that's one of the biggest issues for me, maybe because I'm a woman, but I think I have a very soft spot for the birthing suite that is, or the birthing, the delivery center that is being built in Mangotideke. And it's taking a while, Bernice. Honestly, it's taking a while.
You spoke about water because for those of you who are just joining us and may not know the Mangotideke story, it's a cocktail of issues. It's just not
it's not just about the
center.
Yes, it's not. So this is a village that I profiled, and in that profile you see different things or different needs of the village. One of them is water. They are drinking dirty water. One of them is schools, because they have 3 classrooms. All in one building. It's an uncompleted church building. It belongs to the Methodist Church. And the Methodist Church came to the place. They saw that the people needed a school, so they brought in teachers. They spoke to the GES in Ho, I think, and then they brought in teachers to help. So there's the issue about the school. And then the chief there, as you saw in the story we played, is the midwife. Someone drew my attention to say that I should contextualize his job, and that he's a traditional no, because he's had some sort of training from nurses. Okay. So he said traditional midwife. Okay. So the chief is the only traditional midwife there. So 3 major issues that they have. But of course we're focusing on the birthing suite or the delivery center. It's taken a while. I think that when I went to school, everything went to sleep. There were a couple of people who came and who called me after I did the story and said we wanted to help. But once I tell them the extent of the problem, sometimes I think there is a certain level of withdrawal. I don't know, because they don't get in touch anymore. And for some time, even when I was in London in school, I'll go to the story, the initial story that I did, and copy the link, put it on Facebook, and say, I'm looking for help. Yes, I'm looking for help. But you won't get one person who can do everything. You can't get one person who can do everything. So bits and pieces of... There are people who have said they want to donate books. There are people who have said they want to donate gloves for the man, etc. But I really commend Dr. Novieto for what he's doing, building this delivery center, which has taken a while, but we'll finish.
Yes, I really want to ask you, it's been 5 years. What got you to revisit the story? What at all?
I think that naturally I'm the kind that likes to finish what I start. Great. When I start something, I want to see it to the logical conclusion. Apart from that, I've developed a certain connection to this community that's a little beyond journalism. Yeah. I just get the excitement you see in their eyes when they see JoyNews coming, when they see me coming. It's just something. I don't know how to explain it, but I've developed this connection, and I want to see this done and be happy that I brought happiness and safety to especially the women and children who live in Mangotideke.
Great stuff. Thank you so much, Gifty Andro-Appiah, there doing what she does best. We'll bring you more on this, but there's a special edition of Ghana Connect tomorrow, Friday, September 28, 2018. The focus is to push for input to the national budget. Stakeholders will discuss where the money in the budget should go. We will push for allocation of resources to impact lives. Areas such as infrastructure, healthcare, water, education, social services. So join the conversation on all our platforms tomorrow from 5 p.m. to 7 p.m. Our panelists are Dr. Kojo Mensah Abrampa, Senior Technical Advisor, Ministry of Planning, Dr. Eric Osei-Sibe, Economist at the University of Ghana, Franklin Kujo, President, Imani Africa, Florence Eyisi-Quartey, Acting Director, Department of Children, Ministry of Gender, Children and Social Protection. Do make a date with us. This is News Desk. We'll be back with more.